testosterone treatment or hormone optimization in general is very personalized and catered to each individual. So each individual isn't going to experience the exact same results. But, from my personal experience and from what I see with majority of my patients, there is loose timeline or a loose frame that most people can fall into, right? So initially, when you first start testosterone replacement therapy, you're gonna hit what we call the honeymoon phase. So you're still producing your natural testosterone, whatever that level may be, but we're now injecting the testosterone to get you to the levels that we think you should be at to function at your best, right? So during those first couple weeks, your body is still adjusting to the fact that you're making testosterone and you're injecting testosterone, and all these testosterone receptors that were empty and unused and not getting anything are now flooded with testosterone. So you feel like Superman. And that's why we call it that honeymoon phase. You feel like you're walking on water and you're flying. That usually lasts somewhere between 2 to maybe 4 weeks, depending on patients. Every individual experiences it a little differently, and some patients don't even experience it at all. But that phase ends, and then you quickly hit the shit phase. This isn't working anymore. Now I don't feel like Superman anymore. I feel normal. But if you sit back and you reflect and you remember, you look back on who you were prior to treatment, you realize I am still better than I was. I just feel like I stepped off. And that's basically your body adjusting to this new level. It's learned that this is where the testosterone is at now, and it's adjusting to that. So the next couple months is a trial and phase error. We're adjusting the dose little by little. After we do labs, we see how you feel. We go over your symptoms. Are your symptoms completely resolved? Are they not resolved? Have some of them resolved, some haven't? Those are the key things that we got to look at and combine with the blood work to decide, how are we changing your dose? Are we increasing the amount? Are we decreasing the amount? Are we increasing the frequency of injections? Those are little changes that we make to get you to that right level. And so I would say maybe the first 6 months, you're kind of trialing and phasing. You're slowly seeing these changes. From 6 months to a year is where you really start to kind of notice the difference in the gym. You start to pack on more lean muscle. You start to see the change in physique, and then, from a year plus, we should be pretty stable. We should be pretty consistent. And now we're building on, we're stacking on to those changes, and we're just growing from there. That's the physical part of it. I think the emotional, mental part of it, I would say probably somewhere between 3 to 6 months, you start to kind of notice those changes. You start to realize that you're thinking differently, your motivations, your goals. Wouldn't surprise me if you do a complete 360 and change, your goals from what they were before you started treatment to, 6 months into treatment, because it happens. The blinders come off, you see this potential, and all of a sudden you want to shoot for more. But it does take some time. I personally have been on TRT right now for about 2 years, and I'm still growing and still seeing the benefits. But yeah, it took me, I would say, probably 6 months before I really started to notice the change and then embrace that and kind of grow from there.